Hello and welcome to Crack the Boards. This channel is dedicated to helping you excel in the USMLE by offering over 2,000 questions, complete with answers, detailed explanations, and the rationale to deepen your understanding. We upload 2 new videos every week, so be sure to subscribe, like, and share to support the channel, stay updated on the latest content, and help others discover this valuable resource. In today's video, we will focus on USMLE questions related to gross anatomy and embryology. Let's have a look at the first question. A 3-year-old girl with a history of recurrent otitis media visits the otolaryngologist to discuss the possibility of tympanostomy tubes. Her medical history includes frequent upper respiratory infections and 6 episodes of acute otitis media in the past year. The child appears healthy with normal vital signs. On otoscopic examination, both tympanic membranes show clear effusions and bulging without pus or redness. Enlargement of which structure could explain her recurrent otitis media? A. Lingual tonsil. B. Palatine tonsil. C. Palatoglossal arch. D. Palatopharyngeal arch. E. Pharyngeal tonsil. The correct answer is E. Pharyngeal tonsil. The eustachian tube connects the middle ear to the nasopharynx and opens at the torus tubarius. The pharyngeal tonsils are located above the torus tubarius in the nasopharynx. Children are more prone to acute and chronic otitis media due to their eustachian tubes being at a shallower angle, which hinders drainage. Enlarged pharyngeal tonsils, often due to upper respiratory infections, can further obstruct middle ear drainage. Let's have a look at why the other options are incorrect. A. The lingual tonsils are located on the back of the tongue and do not obstruct the auditory tube. B. The palatine tonsils are located in the oropharynx between the palatoglossal and the palatopharyngeal arches. They can enlarge in conditions like strep throat infections and mononucleosis and are situated below the opening of the auditory tube. C is incorrect as the palatoglossal arch lies below the opening of the auditory tube. D is incorrect as the palatopharyngeal arch is inferior to the opening of the auditory tube. Let's have a look at the second question. A 60-year-old man with a history of uncontrolled hypertension, diabetes, and smoking was discovered unresponsive in a public restroom. A CT scan performed shortly after his arrival at the hospital reveals which of the following? A. Epidural hemorrhage. B. Intraparenchymal hemorrhage. C. Ischemic stroke. D. Subarachnoid hemorrhage. E. Subdural hemorrhage. The correct answer is B. Intraparenchymal hemorrhage, as the CT scan shows bleed within the brain. Let's have a look at why the other options are incorrect. A. Epidural hemorrhage, they appear as biconcave lentil pea-shaped, as the blood is contained between the skull and the dura mater. C. Ischemic stroke is incorrect, as in ischemic stroke, it presents as a region of hypodensity corresponding to a specific vascular territory. D is incorrect because in subarachnoid hemorrhage, the blood is located between the arachnoid mater and the pia mater. E is incorrect because in subdural hemorrhage, it's a crescent-shaped and occur between the dura and arachnoid mater, crossing suture lines. Let's have a look at the third question. A 23-year-old woman in her first trimester of pregnancy mentions to her obstetrician that a close friend recently gave birth to a child with intellectual disability. She asks if there are any measures she can take to prevent her baby from having intellectual disability. What is the most common cause of intellectual disability? A. Alcohol. B. Cytomegalovirus. C. Retinoic acid. D. Rubella virus. E. Streptomycin. The correct answer is A. Alcohol. Maternal alcohol abuse during pregnancy is the most common cause of intellectual disability in infants. Even moderate alcohol consumption may produce behavioral and learning difficulties in children. Let's have a look at why the other options are incorrect. B. Cytomegalovirus. It can cause intellectual disability, but often leads to first trimester miscarriage. C. If isotretinoin is used to treat severe acne during pregnancy, it may produce spontaneous abortion or major craniofacial, limb, cardiovascular, or neural tube anomalies in the offspring. D. Rubella virus is incorrect, as rubella exposure in the first trimester typically causes cataracts, cardiac defects, and deafness. E is incorrect, as streptomycin has been reported to cause deafness in the infants of mothers who were treated with antibiotics during pregnancy. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to stay updated on our latest content.